When Maddie was about 5 years old, she was strong enough to do quite a bit of walking in her gait trainer, but our house didn't have a lot of straight lines, so she had to turn constantly. And then on top of that, it started getting cold that winter. So I decided to build a frame in order to put her gait trainer on a treadmill. That way she could walk technically forever. So you can see here, got some grooves for the wheels to fit in that could lock it in place. And it's set really nicely on this treadmill we bought on Amazon. The wheels locked, and then you had to lock it again because gait trainers have those little locks on them just to make sure it doesn't wiggle. She fit nicely. At this point, she was still using the seat as well as the chest brace. Sometimes she had to have her older sister give her some timing beats as she walked. It worked out pretty well for a little while, and she was able to make the motion, but as always, she was really smart, and she learned that if she leaned forward really hard or just sat back on the seat, she didn't actually have to apply any pressure to her hip and her knee, and she would just be walking like you're swimming in the air, kind of like when you pick up a toddler and their feet continue going. So you can see here her left leg is doing okay, but her right leg, she's just kind of dragging it and just not putting much weight on it. However, we did talk to the PTs, and they said that just that motion of going forward and kind of almost like a bicycle motion helps, and that she was trying to strengthen her quad just by lifting her leg. Even though there's not a lot of pressure going downward here, they said it was still good. So we would run it for 10-15 minutes, however long she could tolerate during the winter while the weather wasn't good outside and we didn't have a lot of room for her to walk around inside. But after a few months, she figured out she could actually lift her right leg, her weaker leg, and place it on the frame of the gait trainer. So we had to take it up.